my first question. You're now back to square one. This is, apart from the 25% which private hospitals can now pick up, the policy the government started with. In his address, the Prime Minister said it's the state governments that said, let us go out and buy vaccines, and therefore we allowed that. But the fact is that the opposition always comes up with wrong prescriptions. You dismiss them because you think that they are wrong prescriptions, and you have the courage of your conviction to say so. You took a wrong decision, you've reversed it. Nowhere was there an acceptance that we made a mistake, we took a decision we shouldn't have. You're trying to put the blame on the state governments and the opposition parties. Should the BJP government at the centre, Dr. Patra, not take part of the responsibility for having over the last 2 months foisted upon us a wrong decision?
See, as far as last 2 months is concerned, I believe, till the end of April, in fact, it was the policy that was going on right from the very beginning, that is 16th of January till last of April. It was the centre which was procuring and supplying the vaccine. It was only after 1st of May till today that decentralization had taken place. I would like to begin by, in fact, quoting a few lines from a letter which was written by Mamata Banerjee on 24th of February 2021, way before, in fact, all these debates and discussions on decentralization even started. And I quote, "Under the circumstances, Government of West Bengal has decided to procure adequate number of vaccines for the members of the public at large. We would request you to kindly take up the matter with appropriate authority so that the state government is able to purchase the vaccines from the designated points on top priority basis, because etc., etc., etc." It is just one letter that I'm quoting. Multiple letters from multiple states, in fact, reached the office of the central government, saying that since it is the constitutional obligation of the centre, health being a state subject, this procurement policy should be decentralized, number one, and the decision as to which age group would be vaccinated should also be left to the state government.
No, but that's true. So that's true, Dr. Patra, but so many times opposition parties say things which the government rejects. The AAP government in Delhi wants to do door-to-door rations. You've said no to that. Several opposition parties thought the Citizenship Amendment Act was a bad idea. You pushed ahead with it. Just because the opposition gives you a suggestion which you accept doesn't mean that it's not your responsibility. You accepted the suggestion, and to that extent, you're responsible for the decision you took.
No, but this one had a merit to some extent, in the sense that, of course, in fact, it was mentioned by the Prime Minister today in his address as well, that health being a state subject, and since the states did not want to feel that they were left out, and in fact, some states giving out an accusation that this is a stepmotherly treatment, in fact, which was being meted upon them. I firmly believe that if this had not been done for a month or so by the Modi government, then the accusation of the state governments on the centre would have always been there. Today, at least the state governments have realized that, well, yes, this kind of decentralization in a humongous process as this is something which is not possible. And I believe if some people say that, well, the prescription was wrong, so why did we accept the prescription? Let them first say that the prescription was wrong.
Pawan Khera, I have here